taking you out tonight. I think you're so special. Have I told you that I loved you lately? And I'm so glad you're my baby. My heart is proud when I sing about you. And every day I know I can't live without you. And I don't mind, I gave up my hustle. For the things you need, I'll use my muscle. Girl, get your bag, we're going out. So we're going out to paint the town. Let's ride. We're going out tonight. So we're going out tonight. Let's ride. So let's ride. We're going out tonight. Now put your favorite dress on and put on your high heel shoes and some of that perfume, that one that smells so good on you. So good on you. Then after dinner, baby, we're going out to hit the town and dance and party all down. Then late night, we'll drive up the coastline and watch the sunrise, just you and I. Let's ride. Let's ride. So we're going out tonight. Let's ride. So let's ride. We're going out tonight. So get out, my baby. Let's ride. Let's ride. We're going out tonight. Gonna wine and dine. Gonna take my baby high. We're going out. Come on, baby. Let's ride. Come on, baby. Let's ride. So let's ride. So we're going out tonight. So let's ride. Gonna wine and dine. I can't wait to take my baby out tonight. So let's ride. Let's ride. Come on, baby. Let's ride. Let's ride. Let's ride. You and me, let's take a ride. Let's ride. Let's ride. Let's ride. Let's ride. Let's ride. We're going out tonight. Let's ride.
Our ministry at the Smoking Glass Hour with Baron Glass is not counting people in the pews or dollars in the plate. It's helping to make a difference, one person at a time. Join us on Spreaker.com or thesmokingglasshour.com. We are on the move in 2015. And by the way, don't forget to follow and like us on Spreaker.com.
Good evening, everyone, and welcome to the Smoking Glass Hour with Baron Glass.
Dr. Jenkins.
We are honored to have you as
Got
a guest
about 10
tonight
seconds.
and want to thank each of you for your faithful support. Without further delay, allow me to introduce to you Mr. Baron Glass. Mr. Glass, take it away.
Good afternoon, everyone. Welcome to the Smoking Glass Hour with Baron Glass on WMAD
24-hour global radio. I want to say, make sure everybody's doing okay that's out there. I know it's kind of raining. Professor and mathematics teacher. He is the graduate of the University of North Carolina, Chapel Hill, with a BS in chemistry. He obtained the PhD degree in biochemistry at West Virginia University Health Science Center. He obtained his medical degree at Duke University Medical School in Durham, North Carolina. He did his residency training in orthopedic surgery at Robert C. Byrd Health Science Center in Morgantown, West Virginia. He was fellowship trained at Harvard in spine surgery. He has experience in orthopedic, pain management, aesthetic medicine, and pageantry. Through his medical spa, he has served as an editorial contributor for Pageantry magazine, and he has had a number of clients who have reached the top of American beauty pageants. Dr. Harvey Jenkins, how are you doing tonight?
I'm doing so well, Baron, and I want to thank you and your audience for having me tonight. You make me sound a lot better than I think I really am, so I appreciate that.
Well, I'll tell you, Dr. Jenkins, as we always do, I'm going to allow you the opportunity to say anything or add anything else to the bio that you'd like to, that we failed to do, so everybody can get a clear understanding of who Dr. Harvey Jenkins is.
I think in the bio, you pretty much covered everything that I think I have been involved in. Some people may not be able to appreciate what connects all of those individual paths, but I look at it as a journey that I'm on, and I don't know in 10 years where I will be, but I know that everything that I've done to this point has led me to the point that I am right now, which is a person that is enjoying writing some books based upon the experiences that I have, and speaking on behalf of people who have chronic pain. The people that have chronic pain are essentially overlooked and mistreated by society, and I need to stand up and provide one voice to encourage other voices to basically make life better for these people who I think traditionally have been misunderstood.
Okay, well, we appreciate that, Dr. Jenkins. I'll tell you, as we were discussing before we became live, I told you that my number one university in the country is Duke University. And anybody that's out there listening who knows Baron Glass, they know that I am 100% a puller for Duke, not just the basketball, but the entire university, based on their principles and what they stand for. And I believe, based on my time spent there at Duke, I've always been able to pick up something from there. And I believe Coach K, he's always instilled in the kids and his players that there is a life outside of basketball, and while they're on the court, they're learning life on the court and off the court. So having said that, and moving forward, I am proud that I had the opportunity to reach out to you, and you accepted the invitation, and we are glad that you're on. So having said that, Dr. Jenkins, we know that chronic pain is the persistent pain that lasts weeks to years. We also know that it's very common in this country, which I believe somewhere research shows that there's about 3 million U.S. cases per year. And it is, to my understanding, medically manageable. And you can get treatment from doctors. And they always tell you to consult a doctor for medical advice. And I believe that you basically have talked about the war on chronic pain and what you can do to fight back. So for those who are out there listening, Dr. Jenkins, who suffers from this on a daily basis, where would you like to start? And we'll end up somewhere in between A and Z, because I want to make sure that any information that you feel people are lacking, they are able to obtain it right here tonight on the Smoking Glass Hour with Baron Glass and Dr. Harvey Jenkins.
And the first statement that I would make is probably a significant portion of the people who are listening tonight understand what pain is. There are two basic distinctions of pain. There is acute pain and there's chronic pain. Acute pain is the kind of pain that you have when you stub your toe or twist your ankle. The kind of pain that is involved there is physical discomfort, and it usually is self-limited, meaning that it doesn't last forever. you know that when you stub your toe, you're probably going to feel better in a couple of days. Chronic pain, on the other hand, is pain that starts with usually some type of precipitation like an injury, but it doesn't always have to start that way. But several weeks, maybe 6 weeks to 3 months down the line, the pain is still there in some kind of form. And it may be that the pain that you experience at that time will be with you for the rest of your life. As you reported, there are 3 million new cases of chronic pain that are diagnosed every year. I think the snapshot cumulative picture of chronic pain is that it affects about 100 million people in some degree. It doesn't mean that it's always necessary for these people to seek medical attention, but 100 million people out there have some idea what chronic pain is. Now, with that, and of course the 600, I think it's I think it's a $6 billion industry related to the treatment of chronic pain medically. There has to be a recognition of the fact that comes as a cost. The cost being is that chronic pain patients are too often treated badly by society. People that need to be treated for their pain are seen as people who have no desire to do meaningful or purposeful work, people that are just out there seeking drugs, and for people and people are frequently branded with the a notion that they don't want to help themselves. That is a problem which gets in the way of people who have chronic pain and don't really know what to do about it from actually accessing the pain that they need. In treating patients with pain for the past 16 years, I've gotten to see so many different examples of people in pain and people struggling with pain and the impact that it has on their lives. What I've tried to do on the basis of this experience is to simplify the process. There's somebody out there who's listening now who has pain and doesn't know what to do with it. They don't know where to go. They don't know how to approach their medical professional about the particular problem. Or perhaps they have someone in their family who is struggling with pain or suffering with pain. The book that I wrote that addresses this problem is one called The Patient's Guide to Pain Management. And basically what this book espouses to do is to help patients find that access. Some people don't know how to find a doctor for pain. Some people have a family doctor, but their family doctor may be resistant for whatever reason to managing or treating their pain. And so people need to understand strategies of how to deal with those situations when they encounter them. There are other people out there who understand that they need to have their pain medically managed, but they don't know what to expect from the doctor who's going to be treating them. And that is actually a sticking point because it's not straightforward. Sometimes the medical practitioner that you encounter is really not your friend. He's really the enemy, I call in some aspects, in a battlefield, and that you need to know how to assess your enemy properly so that you can win the war and actually access the pain and the care that you deserve and that you need. The other thing the book discusses is your responsibilities as a patient. Sure, once you understand that your doctor understands your situation and your doctor has come up with a treatment plan, there are certain responsibilities that patients need to take so that they can secure or be secure with the treatment of their pain and they can maintain it for as long as they need it. There's certain things that you should not do because that can actually interfere with the process of the doctor-patient relationship and affect you adversely, not only with that doctor but any other doctor that you see in the future. The last element of this book is that I present a few pain management resources because I think the most important thing that patients need to understand is that they're not alone. You've got 100 million other brothers and sisters and 3 million other new brothers and sisters this year who are going through the same thing that you're going through. And it's important to know that you're not alone, you're not different, and there is nothing wrong with needing to have your pain addressed.
Okay. I'll tell you, Doctor, you mentioned in some of the information that was submitted, if you suffer chronic pain, there's a war being waged against you. Like a war among nations, this war has many fronts approaching you from every direction. Dr. Jenkins, for the audience, Tell us what this way is and how it is affecting those who live with this chronic pain on a daily basis.
And that's a very important a question, and I actually entertain that in my second book called 5 Ways to Effortlessly Outsmart Your Pain Doctor. That title, actually, I don't want people to get offended or think that's a disturbing way to present it. It's actually a tongue-in-cheek way of basically giving patients what they need to know to navigate through this so-called battlefield that exists around pain management in order to get to the care that they need. The doctor actually is someone who is in charge of your care, who safeguards your care, develops your treatment plan, but in many ways the doctor can be your enemy. Another enemy, your insurance company. Your insurance company actually places demands on the ways that your doctor can treat you. And so obviously you have your insurance, for those of us who are lucky to have it, to be able to protect you for health issues and to be able to cover those and to make health care affordable. There are some traps that the insurance companies set for you that really restrict your access to care. Another enemy in that battlefield are the government regulatory agencies. These include the ones who are responsible for regulating your doctor and pain policy in your state, such as the state medical boards. Each state has its own medical board that provides licenses to doctors, and their charge is to protect the public. And in so doing, they set policies that doctors must follow. It doesn't mean, however, that the policies that the doctors are forced to follow are necessarily in the best interest or benefit of the patient. Another government agency is are the state bureaus of narcotics. These are the agencies who are technically responsible for regulating medications that are prescribed for pain, the ones that are called controlled substances, such as hydrocodone, Lortab, Percocet, OxyContin, those types of medications. These agencies also set policies that physicians must follow, and their job is to make sure that these medicines don't end up hurting patients. But in the process of so doing, their policies sometimes come into conflict with what the state medical board says, and even the Drug Enforcement Agency. The Drug Enforcement Agency is the federal level of control of these medications, which is different than the state-controlled Bureau of Narcotics. But even with all of these entities, even though they all regulate these medications and the behaviors and practices of certain doctors who prescribe these medications, their rules are sometimes in conflict with each other, and again, that can be to the detriment of the patient. Mm-hmm. And so it is a battlefield, and all of these agencies that are supposed to protect you and make things safe for you actually can sometimes work against you.
Right.
The purpose in me telling you this is that most people don't know that.
Correct.
And I've had to work in this system and watch patients have become victim to these things, and so that's the reason why I've actually taken the time to write a book for it. Now, I think a lot of people out there are are wondering, how on earth can my doctor be my enemy? Well, let me tell you, doctors, the way that doctors and physicians and surgeons are trained in this country is very fascinating to me, both from looking at it from a distance and also having gone through the process myself. Doctors are very competitive by nature. They have to perform well in school. They have to find ways to distinguish themselves among other students in their classes so that they can get the best grades and the best recommendations to get spots in medical schools. And there isn't a spot for everybody that wants one, so only the strongest survive. It's kind of like the Survivor television show. Mm-hmm. Once students get into medical school, it's not over. Actually, the cutthroat nature of trying to be better than your fellow student actually intensifies during those years. And everybody wants to have the highest scores. Everybody wants to have the adoration of the medical school professors and deans. Because in the end, that allows you to get the recommendations that you need to go into the specialty training of your choice. Once you land that specialty training, which is also very competitive, that's still not the time that you relax. You're at the bottom rung of a totem pole organized kind of like the military, where the general is the attending physician or the real doctor who supervises the training, and you have a chief resident, a junior resident, a first-year resident, and you are the lowly intern, and you take orders from all of those different levels, and you get screamed at, you get sleep deprived, and you have a miserable existence. But the longer you stay in it, the higher in the ranks that you rise, and eventually you become the chief resident, and then you turn it into exactly the thing that you despise. Angry person that basically has to dole out orders and humiliate people. And again, I'm being very critical of the medical profession. I would not do anything over. I believe it helped me in so many different ways. But again, there's certain parts of the actual training of physicians and surgeons of this country, many of which are being addressed and made better, but develop that help develop the type of person that you're going to meet when you make an appointment to see that doctor. You're seeing a person that has risen through all of those ranks, has had to compete, and has gone into so much debt to get to that point. He or she puts the shingle on the door, and then you walk in the door, and then you've got to deal with that.
Right.
That person is very protective. That person is very protective over their ability to practice and their medical license. And as a chronic pain patient, they're not going to let you take it away. So if you do anything wrong with your medications, the doctor is compelled to err on the side of caution because, one, he doesn't want or she doesn't want you to be harmed by these medications, but he or she also doesn't want to lose his medications for prescribing to you and you having done something dangerous with it.
Okay.
So that's an example of how the doctor, traditionally, who is the good guy or the good gal, actually is one of the nemesis that you have to deal with in order to get to the care that you need.
Okay. Doctor, Miss Michelle Carter's out there saying that, great job, Dr. Harvey Jenkins. You have all of us supporting you. Michelle, if you're out there, if you'll let us know what state you're calling in from, we'll be glad to add it. I have a question, Dr. Jenkins, from an individual out there in Louisiana. If tramadol 50 milligrams is considered an addictive drug now after it has been classified as non-narcotic for years, and if it's okay to take that with meloxicam, I believe is how you pronounce it, for a week to get inflammation under control when you have chronic back pain flare-ups?
Okay, that's a very excellent question. Obviously, I predicate everything that I say with make sure you have the discussion about the specifics with your prescribing doctor. He or she will definitely be able to tailor the advice and customize the advice specifically for your cases. I can, however, speak about my experience. Meloxicam is a member of a family of anti-inflammatory medicines that, in my experience and in my opinion, works very well for the control of inflammation that is associated with things like chronic back pain and any type of inflammation that is associated with pain. Inflammation is, I must clarify, is different from pain. Inflammation can be painful, but I believe, and again, based upon my experience in treating 20,000 patients over the last 16 years, is that controlling inflammation makes pain easier to control. So I believe without hesitation that unless there are contraindications such as allergies to anti-inflammatory medications or allergies to meloxicam or Mobic, it's also called, specifically, that it is a wonderful adjunct in the control of pain. The drawbacks of the medicine are minimal. It tends to not be as hard on the stomach as other members of the anti-inflammatory class, with the exception of Celebrex, of course. And so I think it is all in all, it is a very good choice. Now, tramadol, as the listener has indicated, has been kind of on the fence in terms of whether or not it's an addictive medication, whether or not it should be classified as a narcotic medication, or whether it should be a controlled substance. I believe that the DEA probably defines it one way, but state bureaus of narcotics may have a little bit of leeway with how they classify it. I can tell you that tramadol does have a potential for addiction, but it's very, very, very small. You don't find a lot of people having to go to rehab or detox because they're addicted to tramadol. So it does bind in the body physiologically to narcotic receptors, but it is a very, very weak, what we call agonist of those receptors, and so it's not associated with any significant addiction potential.
Okay.
However, in the state that I live in, Oklahoma, it is classified as a controlled substances, but it is a very low level of control. It's either level 4 or 5, whereas Lortab and oxycodone are level 2. And so, yes, I think a patient can tolerate tramadol, and if it actually helps with their pain, then it is a wonderful way to help control pain because the addiction potential is low, the side effect profile tends to be low, and it seems to be a safe drug. It's been out for many years, and again, does not appear to be associated with any significant drawbacks that for most people.
Well, I'll tell you, Dr. Jenkins, Michelle Carter from Oklahoma says, he was my doctor for at least 6 years. He went above and beyond for us, and his knowledge is unlimited. Thank you doesn't even come close to what he deserves. So that alone, Dr. Jenkins, speaks for itself. Let me ask you this now. When we talk about the doctor per se being the enemy, and when we look from a historical standpoint, let's take older individuals, specifically those in the African American community who believe that whatever the doctor says is like gold. So when we take the doctor in this case potentially being that individual's enemy, is there a way where we can get around that, or is there some type of local boards that need to be implemented to try to help these patients? Because I've seen on numerous instances where people have been prescribed medication and they get hooked on that medication. They can no longer receive the medication, and then they go from getting it over the counter to actually either buying it from those who sell it, who don't use it. It becomes a criminal act. Have you experienced that in your profession?
Absolutely. What you're describing is the result of the war. The war on chronic pain stigmatizes patients who actually need help. It makes doctors afraid to prescribe the medications that they need because the doctors are afraid that their licenses are going to be yanked by the medical board or the Bureau of Narcotics simply for prescribing these medications. And it makes people prejudiced against people that have pain and stigmatize them into thinking that everybody who has pain that goes to the doctor for it is a drug addict. And so people who actually need care may decide not to get care because they're afraid of that having that label, and the pain may get to the point where it's so bad that their only option is to go to the street or to go to somebody that they know and buy some pills from them. Now, yes, it is clear, and I do not deny that there are potentials for addiction with prescription pain medicines, but in my opinion, that's the minority of cases that we see. An example that you mentioned of the older person, the older you get, if you have the luxury and the honor of living to be 70 or 80, you're supposed to have pain. The discs in the back, in the spine, are kind of like tires. If you use them long enough, the tire's going to get some wear on it, and eventually the tires are going to blow. And that's what happens with elderly people, is that eventually they have degeneration in their discs and they hurt. Now, some doctors who specialize in the treatment of elderly people recognize this and are able to prescribe to patients to make them comfortable and improve the quality of their life. But some doctors actually blow off that situation and say, well, you're just old. Everybody who's old has pain. You just take an aspirin.
Right.
There's a problem with that. Overdosing on narcotic pain medicines can kill you, but so can taking too much aspirin, especially if you're elderly. Aspirin is a kind of anti-inflammatory medicine that doesn't have the protections that meloxicam has, meaning that it actually weakens the lining of the stomach and allows ulcerations to occur and bleeding to occur from those ulcerations in the stomach. Aspirin also causes decreased platelet aggregation ability in the blood, which means that it thins your blood. And sometimes you can use that for a therapeutic benefit for a patient that needs to have their blood thinned. But for a person that doesn't, you've got thin blood and now a fragile lining in your stomach, and you're 70 years old and you hurt, and you take aspirin, you can easily lose a considerable amount of blood through your GI tract by taking aspirin. And for people that don't understand that, if you ever have the luxury of going to the intensive care unit at the hospital in your town, it's full of 70-year-old ladies for some reason.
Right.
Who have lost a lot of blood and are clinging to life, and they can't keep up with the blood loss even by giving them transfusions because they took aspirin. If aspirin was a new medicine that was released on the market today, it would be by prescription only. It can be a dangerous medicine because people don't realize of the particular dangers. However, in most hands, in younger people, it's a pretty safe and effective medicine. But in the case of a person like that, a narcotic medicine that doesn't cause thinning of your blood and doesn't affect the lining of your stomach might be the better choice. And it's important to find, obviously, a medical doctor who understands the pluses and minuses to provide that particular patient with what he or she needs in order to improve their quality of life. Mm-hmm. This is also important. People think, well, you just need to man up. If you have pain, you man up and deal with your pain. I got pain too, and I still do. I don't take any medicines at all. Well, everybody's a little different, and I caution any and everyone that I see, don't try to step in you can't step into the body of another person and feel what they feel. I have a bit of chronic pain myself, and it is not pleasant. There probably will be one day that I have to see a pain management doctor, because I know at 50, if this is what it feels like, at 60, it's probably going to be a lot worse. But the effect of pain on your body for prolonged periods of time is to increase stress hormone levels in your body. And what that serves to do in some people is that it basically scuffs the linings of your circulation, your arteries around your heart, and people end up getting heart attacks and strokes because their pain is not controlled. And again, the thing that connects them to is the stress levels associated with pain that's not treated. Mm-hmm. I like to tell people, to anyone that criticizes you or makes you feel bad for having pain and needing treatment, it's better than having a heart attack. And so you're actually doing the right thing to not only improve the quality of your life, but to actually extend your life.
Well, I'll tell you, Dr. Jenkins, Annette Gentry out there says, best doctor ever, helped me more than anyone else. I believe there's a Mark Reese that's out there who's saying this doctor cares not only for the health of a patient, but also the person themselves. What's happening to him is the only crime. Now, if you care to get into that, that's fine. But what I'll do is, what I like to do, Dr. Jenkins, because people take up the time to listen to my broadcast, I like to make sure that if they take the time to send something to me, I take the time to read it. So I ask that my guests bear with me, because it's in direct support of you. But when you say, Dr. Jenkins, because I'm looking at a community, let's say the elderly people who may have little or no family at all. And I would assume, because the doctor is supposedly highly intelligent, and they know that they can get over on this individual person. And I heard you mention that people, doctors in specific, they say, oh, well, it's just a little pain. When in fact, it's chronic pain, but they don't take the time to really engage in that. How can we, as a society, help these people who really need the help that they need, rather than being shunned, but at the same time the doctor who they are visiting? And I'm not talking about all, I'm not grouping everybody in the same category. I'm talking about those who fit the shoe they wear. How can we help these individual patients, or those patients, to make sure that they are getting exactly what it is that they need? Because when they go to the doctor, Dr. Jenkins, they expect that doctor to be their friend rather than their foe.
Exactly. And I think most doctors are well-meaning, and they are ethically bound and morally bound to do the best that they can to take care of you. The flip side of that is that doctors are human beings too, and they are guided by their own environment of pressures, by insurance companies, by medical boards, by other government agencies to basically make decisions that really don't have much to do with medicine. The best thing that anyone out there can do to arm themselves is to become educated. First part is look inside yourself. If you don't have pain, don't make assumptions about people that do have pain, because you never know. If you live long enough, you will have pain, probability says, but in the meantime, don't judge a person that has pain. One of the things that I mentioned in one of the books is that when you come in the waiting room of a pain doctor, be courteous and respectful to the people that are in the waiting room with you. There may be people there in clothes that aren't very nice, who may not smell so good, who may not be wearing makeup, who may look very miserable, but you don't know that patient's path. You don't know that patient's journey. That a year ago, that patient may have been totally different. The effect of the pain may have been what put that patient in the position that makes you want to judge him or her. So I think it's important that people, everybody, not just people in pain, to look inside yourself and clarify all the prejudices and the things that you've heard about people with pain, and just get rid of that, throw it out the window. The actual people that actually abuse pain medicines is a very small minority of all the people that are involved with pain management. So don't blame everybody just for the worst examples that you may have heard about, on the street, or you may have heard about in the media. It's not what you think it is. The second part is after you look inside yourself, is to look outside yourself. When you do have pain management, it's important that you when you do have chronic pain, it's important that you understand the elements of pain management. You understand the obstacles that you're going to be facing, with that, from your doctor's own prejudices to what your insurance company might want to pay for or not want to pay for. You have to be able to address those things and fight those things, because that's the only way that you're going to win the war. And for bonus points, you need to be involved in your community. Pain management in America is becoming so repressive that pain patients are criminalized. They're all treated like drug dealers, like drug addicts, and the doctors who try to prescribe and treat them honestly and by medical principle are being treated like drug dealers. And what the states have done in order to flex their muscle and to show everybody that they're trying to address the war on prescription pain pill abuse is that they're going after doctors who prescribe to people with pain. And again, that makes other doctors hesitant to prescribe for people that have pain, and that leads people to suffer needlessly and to look to the street for their relief. That increases crime on the street that affects us all.
Right.
And so in my state in particular, because we've had a couple of nasty examples of state overreach, and again, I'm speaking out so vocally and voraciously now because as a doctor, I am a victim of the war on chronic pain. So I'm in a position where I must speak out. I'm currently, and I can't speak much about it, but filing a lawsuit against the state of Oklahoma. And basically, it is over the issues that are related to chronic pain management and the fact that the government is so aggressive in trying to turn everybody into a criminal that they happen to step on your rights and treat you like a heroin dealer when you're just a guy trying to help people who have pain. And so I don't speak about this from purely an academic perspective. I speak about this from somebody who has lived through both sides, as a person who has a little bit of chronic pain and understands what the stigma and the perceptions out there are about people with pain, as a physician who has treated patients with chronic pain and hearing their stories and understanding their journeys, and then as a person who has to fight for the right to do the job that I've spent so many years training for.
Dr. Jenkins, there's one listener out there who says, I didn't realize chronic back pain could have effect on your heart. And there's another question that's out there that asked Dr. Jenkins about judging by appearances and not just medical evidence. And I'm almost certain there are some specifics to that. So however you want to answer that, you're welcome to do that, because if it's something that our listeners and the audience need to know, because again, when we use the word ignorant, we're using it from the standpoint that when you go into the doctor's office, like you said, some things you're just not aware of. So if there's anything or any information that you can provide that they might be able to become more aware of, you feel free to provide that information if you don't mind.
Absolutely, I don't mind. Judging by appearance, I have coined a term that probably never will become a viral phenomenon, but I coined a term called prejudice projection phenomenon. And this is something that many physicians and people who take care of patients, and that not only includes physicians, but nurse practitioners, nurses, and other ancillary professions. And basically what this is that a physician meeting you for the first time is able to get information from you, from what you tell him or her. They're able to look at you and to assess you, and that assessment may be influenced by who they are and how they were raised, and you may be completely different from them. And so the fact that you may be racially different from your doctor, that may have a bearing in the way that the doctor perceives you and the way that the doctor treats you. The fact that your gender may be female may make a difference to other doctors. And again, that difference may not be one that's necessarily beneficial for your care. It is a very human thing, and basically it is also a very protective mechanism that physicians use to basically try to develop a rapid assessment of who you are. As I mentioned in the 5 ways to effortlessly outsmart your pain doctor, the physician, when he or she arrives at that conclusion is not always correct. And the mental algorithm that they're using is based upon how they were raised, how many patients they've seen over the past several years that may look just like you, and they superimpose all of that information and project that information on you to come up with a prejudice. And again, it may not be a prejudice that works against you, but it usually is one that works against you. And what you need to do is obviously recognize that when it happens, and to be able to defend yourself when it does happen. And the way that you defend yourself is with your mind and with your voice. And again, that's the main thing that you need to do to outsmart any doctor or any other person that you come in contact with who may be an impediment to getting the care that you need.
Well, I'll tell you, Doctor, for those who are out there listening, if you'll just bear with me, because I have 3 different systems going on, Doc, and everybody's messaging me, and I'm loving it, so I may be a little slow getting to them. One comment, Doc, is that you're a very humble man, and you almost died treating them. And then there's another that's out there who said that they just went through this with their son who had a broken arm with the same individual facts that you're basically talking about. And then I have someone out there saying that they have a rare disease, and ICE had 30 surgeries, and they have to jump through hoops to get their medication just so they can function on a daily basis. Now, when we look at all of this, Dr. Jenkins, is it fair to assume, or is there validation that some of this, what we're talking about tonight, as far as the enemy, is it intentional, or is there a specific goal that's trying to be reached by doing all of this? You care to elaborate on that in any way, shape, form, or fashion?
Absolutely. First, to the listener that indicated that they had to have 30 surgeries, you do not have to be a rocket science to understand that someone who has had to have that many surgeries may have to have may have chronic pain that requires control by a physician. Now, why that person has to fight in order to make that point to a doctor is beyond me. This is America, and we are not dumb people. Why does that person have to fight? The reason that person has to fight is because of the agendas that make it hard for physicians to prescribe to patients. Again, the whole process is stigmatized and criminalized and that makes it harder for the person that really has pain to get the care that they need. And it's wrong. And it is so wrong that the rest of my life will be dedicated to trying to right that wrong. Again, it begins with one voice and one interview like this with Baron Glass and people out there listening. Hopefully some of them will be inspired to have conversations with their physicians and say, hey, this is a problem that's going on. What are you doing to help with it? What are you doing with your medical societies to help address this problem? Because it not only affects patients like me, but it also affects doctors like you. What can we do? And getting the word out and spreading the word out, and even writing a letter to your state representative or your state senator to say, hey, I'm a patient in pain and I'm suffering. The policies that we have in this state make getting access to care so repressive. You've got to help me. Now, interestingly enough, legislators and politicians are just like regular people.
Right.
10% of them have 10% or more of them have chronic pain. Some of them are probably being treated by physicians for this particular problem. Some of them are maybe afraid to do it because they're afraid of the stigma that's associated with that, and that could harm them in their political aspirations. However, they live by different rules, perhaps, because if you're the governor or if you're the lieutenant governor or you're a politician, then of course your doctor is going to accommodate you rather than someone who doesn't have political backing. And so my advice for people who are listening is that write those letters. The worst thing in the world that could happen is that nobody reads it, but on the off chance that somebody does, you may find a champion in your state that may help produce legislation that makes it easier for everybody.
Right.
Believe it or not, doctors are smart people, and they're smart enough to understand the risk factors and red flags associated with prescription medication abuse. They're able to determine signs where people are overdosing, and most doctors are willing to do it. Doctors don't get paid anymore. Many surgeries and still has to fight for the right to have their pain managed. And again, I've seen that in my town. I was actually one of the few people that accepted the state insurance called Medicaid. It's also called Sooner Care. Now, I did that because to me, if a person wants to see me, that's the oath that I took. I want to see you and I want to try to help you in whatever way that I can. However, when you're one of the few doctors in the state that is seeing a whole population of one particular insurance, people can get the wrong idea to what your motives are. My motives were not and have never been to prescribe all the medications that I possibly can to someone who says they hurt. No, there are steps that I take to make sure that the patients that I prescribe to are the appropriate ones and the appropriate indications. However, that costs a lot of money for the state. The state doesn't like to spend money sometimes, and of course they always are going to be suspicious and in surveillance mode when someone is using their resources. But my take on that is that that's what insurance companies are for.
Right. Right. Well, I'll tell you, Doctor. There's one individual that's out here that indicated that they have been denied by their doctor because of Medicare, and they can explain they can't do shots any longer. And it has gotten to the point now where they have been rejected so much. Now my spouse wants a divorce. He is worn out from my pain, which is ridiculous here in this country. There's another individual that's out there that indicated that, there's some information that you actually did yourself, doctor, where, you were able to, you actually had, you came back to work on oxygen, okay, and you were still steady trying to help your patients do the things that they needed to do. So it shows the concern and the consideration that you really have, for those that are out there. So when we look at all of this stuff, in addition, there's another comment with the individual who had the arm that was broken. The doctor didn't want to give anything for pain, told them to give their son Advil, but his personal doctor said he would have to take too many and could cause bleeding. So it looks like I'm not going to go so far as to say malpractice, but it looks like there's a little maltreatment, and there is a certain group or a certain populace that could actually end up, because the poor are going to always be at the bottom, always, and they're always going to be treated as such. So if I were to take all of this information and absorb it, then I'd venture to say that the vast majority of poor people are actually not receiving the benefits of health care that they should. What would be your take on it?
That you hit the nail on the head. Poor people and people with less means and less political connections are the ones who suffer most at the hands of restrictive and repressive policies by the government. And again, these policies don't have to exist. In my state in particular, I think the statistics are as follows. Prescription pain-related deaths per year are overdose deaths are probably 200 to 400 cases a year, I believe. Alcohol-related deaths are half that. However, if you include the injuries and hospitalizations related to alcohol injuries, like car crashes, it's like 9 times higher than prescription pain pills. So less people die with alcohol-related injuries, but that doesn't mean that they're not paralyzed or debilitated in some way. So my feeling about this is that you're focusing on overdoses and addiction, but the treatment for that is not to criminalize doctors and make all patients feel like addicts and make all doctors feel afraid to prescribe. Mm-hmm. The solution is that when you recognize addiction, make sure you have the right resources and tools available, like rehab and detoxification programs, and to help these people. Yes, it's expensive, but I think a human life is worth it. If that's the alternative, I would choose paying the money for an additional rehab bed than the value that person had to their family. And going back to the situation, yes, I got sick probably 3 or 4 years ago. I'm like most physicians and healthcare people. Anytime I start coughing, it's just a flu. It'll go away. It's just a cough. I'm not going to bother with going to the doctor because I know what the doctor's going to say. It's just a cough. You got some kind of respiratory virus. Just take some aspirin. Call me in a week. Get out of here. That was the wrong call. 6 weeks later, I was still coughing, and it got to the point where I had a full-blown pneumonia, and I was in the hospital for 40 days. My family was called. My sister, who's also a doctor in North Carolina, flew down. My dad, who's 70 or 80 years, who's 70-some years old, flew down from North Carolina. My little brother, who I hadn't seen in 25 years, they all flew down because they thought it was going to be my last moments on Earth. For about a week of that time, I was on a ventilator, and I developed something called adult respiratory distress syndrome. And that's when your body starts to fight against your lungs, and your lungs fill with fluid as a response to the pneumonia. It happens in a small percentage of cases, but I was one of those cases. When they put the tube down, even though I was delirious, I knew as a physician that I had a 50-50 chance of coming out of it. That placing the tube down could have been the beginning of the end of my life. Eventually, I fought back, and I had great doctors, and I walked out of that hospital. I was wheeled out of the hospital. I'd lost about 80 pounds during the hospitalization, had to have physical therapy to relearn to walk again, was on oxygen for about 3 or 4 months because my lungs could not handle breathing normally. And the minute that I was well enough to go into that office, even when I had an oxygen tank, I was going to that office because I missed my patients, because that was the calling of my life. That's what I dedicated my life to, and I felt like my patients missed me. And they did. Gradually, I got strong enough to get off the oxygen. I've been off the oxygen for at least a couple of years now, and I'm doing really well. I still have some residual lung damage, but it doesn't stop me from, doing what I need to do.
Correct.
Talking as much as I need to talk, and, of course, eating everything in sight. So
I'll tell you, Doc, we do not want to wear you out on that. There's an individual out there that says, I am taking medication from 2011 from my retired physician that had me store prescription in case of emergency. I am almost out. So scared. I suffer from, and I'm going to spell this out because I'm not medically savvy. It's fibromyalgia and so much more. Doctors don't want to believe FMS exists.
Yeah, fibromyalgia. Yes, some doctors don't believe that it exists. Some doctors believe it is a mental disorder and that the patients who have this diagnosis are crazy. I believe that fibromyalgia is a real entity. Just the ability to actually diagnose an anatomic or cellular lesion is something that medicine is not advanced enough to do at this time. But I've seen it. I know that it's real, and I know that it's also extremely hard to treat. There is someone out there who will treat you. It doesn't necessarily have to be a pain management doctor. It may be a rheumatologist. It may be a family doctor. The solution to your problem, if I were you, is to hit the pavement and find that doctor who understands fibromyalgia. In just about every town where there are doctors and hospitals, there's somebody out there who knows and is not afraid of treating it and will not brush you away. I was one of those doctors. I knew there is no cure for it, but there are ways to manage it in some people, and I was one of those doctors who was willing to try. And again, if it didn't work, I was not going to stop trying. If the patient decided to leave because we tried everything that I could think of, then that was fine. But I didn't dismiss patients because I didn't know how to treat them or wasn't willing to treat them. And again, I think that's the kind of doctor that you need. And I believe that in every community, there's probably at least one who's willing to do it. You just may have to shop around. In my first book, the Patient's Guide to Pain Management, I actually give you a list of steps to try to find doctors or healthcare practitioners. That some of them are really obvious, but some of them are not obvious. But if you can download that book on Amazon, you can actually find the simple ways that you can use to find the doctor, to get to the doctor you need. And again, most of them are common sense, but some of them are probably things you wouldn't think of. That certainly may help you.
Mm-hmm. I'll tell you, Doctor, one of the individuals who had sent that information on FMS, they indicated, and I'm sure you can elaborate on, they says that FMS is a death sentence. Now, I know that's extreme, but factually, can you tell us exactly what that is and what people may need to look out for, just in case they may know somebody or whatever the case may be that has it, that maybe not acknowledgeable to understand that they do have it.
Absolutely. Fibromyalgia syndrome, FMS, is not a disease like cancer. It's not one that will take over your organ systems and then stop them from functioning, and then you die from organ failure. It will not kill you in that sense. It will hurt you, and again, to be in chronic pain that's present 24 hours a day is something that, even though it won't directly kill you, it can certainly affect the quality of your life, and it can actually make you not want to live.
Mm-hmm.
And what it involves is basically pain associated with the fibrous tissues and the muscles of the body. Now, with some muscle disorders, and there are hundreds and hundreds of different muscle disorders, genetic and acquired, but this particular muscle and connective tissue disorder is not one that can be easily defined if you take a biopsy of the muscle tissue. Some studies have shown abnormalities in the arrangement of something called spindle fibers that leads to trigger points. Some biopsies of people that have the symptoms of and diagnosis of fibromyalgia don't show these changes. So what we actually think is that fibromyalgia is not just one disease or one condition, but it's actually a multitude of conditions that all present to the medical attention in the same way, which is pain, usually in the back, usually between the shoulder blades. There are several points where people have the associated trigger points, and and they can be precipitated on exam. There's no blood work test that can be done to conclude that it's a disorder, but blood work should be done to rule out other types of conditions, including things like other muscle diseases like polymyositis, and other rheumatological conditions that affect muscles and joints. Mm-hmm. Once those other conditions are ruled out and the actual pattern and of pain and trigger points are identified, the diagnosis of fibromyalgia can be made, and then people can be placed through a treatment program. For a lot of people, the treatment is antidepressants. It's not because the people are depressed, but depression can go along with fibromyalgia. But it's just that the same nerve pathways that produce depression in some people that are blocked by these antidepressant medicines are also pathways involving nerves that create these muscle phenomenons. And so the actual antidepressant just happens to help fibromyalgia as well as helping with depression. But again, you're not being treated for depression. You're actually being treated for whatever the nerve deficit is that the antidepressant medicine actually helps control. Mm-hmm. Again, it will not kill you in the way that cancer will kill you. It will not kill you in the way that uncontrolled diabetes will kill you. But certainly, it will can ruin the quality of life. And I'm sure the suicide rates associated with fibromyalgia are high. Probably the heart attack and stroke rates with fibromyalgia are probably higher than in that population than the people that don't have that disorder or normal people. And so it definitely is something that needs to be addressed. And again, it's just a matter of finding the right physician who understands and doesn't think it's a crazy person's disease. Now, let me expand on that just a touch.
Go ahead.
Sometimes your doctor, and again, I hate to seem like I'm anti-doctor because I'm really grateful. Training at Duke Medical Center and Harvard were among the feathers in my cap, and that I would never turn my back on that training and the wonderful doctors that I met. What I'm talking about is an attitude and a state of mind that some and not all doctors carry that actually gets in the way of treating conditions like this. The routine that you get from some doctors is the blame the patient routine. Okay, you come in with a complex problem that they don't know how to treat, or they've tried to treat it and doesn't work very well, and so instead of trying to treat you, they blame you. Oh, well, you're a smoker, so I'm not going to treat you because you need to stop smoking, knowing that that's probably really tough for a lot of people to quit. But that gets rid of the patient, and that solves the problem for the doctor. The same with fibromyalgia. It's really, really hard to treat. The patients are completely miserable. They're so uncomfortable, and that's hard for a doctor to deal with. If a patient has another condition that is easily treated, then that makes the doctor's day because he or she can go on to the next patient. But no, the fibromyalgia patient is going to hang you up because your treatments are probably not going to work, and you're probably going to have to struggle in order to find the best treatment. And so instead of rising to the challenge, some doctors, many doctors, basically say, well, you're crazy, and I don't want to treat that. So the patient gets offended. The doctor thinks I'm crazy. I hate him, so I'm going to leave. And that's how the doctor solves the problem. And so when a doctor says that he doesn't or she doesn't believe in fibromyalgia, I personally feel that's a cop-out. It's that you're just too stubborn, too lazy, or too non-creative to work with this patient. But when you went to medical school and you took that oath at graduation, there was nothing in that oath that said anything about taking the easy way out. You're supposed to struggle, just like with anything in life. You try to help your patients. That's what you took the oath for. That's why they gave you the degree. That's why you spent all that time in training. You weren't supposed to take the easy way out. So the fibromyalgia patients that left my practice, it wasn't because that I didn't try. I gave it all that I could. And for many of the patients, the therapies worked. I found that it took a little bit of a combination approach, with anti-inflammatory medicines to control inflammatory processes, medications that work on nerve activity to kind of help control some of the nerve symptoms, and a medicine for pain. I think for the large majority of fibromyalgia patients that I saw, that was helpful. And I think other doctors, and that doesn't require any ingenuity. I think other doctors just need to be a little bit more patient with their patients.
Okay. Well, doctor, if we're looking at all of this, and normally if you in education you have educational consultants or whatever the case may be, is it fair to say that somewhere in the medical field or somewhere thereof that there may need to be some type of individuals that are appointed specifically to make sure that individual patients are getting, because I'm just listening to what you're saying. I can imagine the many people that go daily with the chronic pain that could ultimately be treated, but when the doctor tells them no, the patient automatically, listen to the doctor because it's kind of like the minister. That's who they listen to for, spiritual guidance. So when you go to the doctor, you're looking for the doctor to tell you, give you the most accurate information. And in some cases, from what I'm hearing, the doctor's doing totally opposite of that. So how can we, as a radio station, WMAD, we make a difference? How is it that we can start this conversation, not just tonight? Because what I'm going to do at some point, I'm going to say, Dr. Jenkins, I know that your schedule is busy, and I know that you're probably all over the country, but you see how simple this is. So I'm going to say, Doc, once a month, twice a month, or often as you can, you have the Smoking Glass Hour and 7 days a week to get these messages out to all of those people that are out there. So I'm telling you that beforehand, but how can we help people that really need this help based on what you're talking about?
It's speaking up. Sitting down is not serving any purpose. You need to get up. You need to speak about it. Everybody who goes to see their doctor, you need to incorporate that as part of your conversations with your doctor the next time that you see them. Whether you're a pain patient or not, they need to know that there is concern and that you care, because that might be the wake-up call for that doctor to say, I'm not going to put up with any more of these really silly state regulations that are really harming patients and tying my hands up and making me fearful to do my job. I'm actually going to speak to the people that in my professional organizations, and we're going to do something to make this happen. Again, talking to your politicians, and to your minister. If you happen to know people in powerful positions who can amplify your voice and my voice, that's the people that we need to get with and let them know that this is a problem and this is the beginning of a movement. In the end, we're going to make medicine a better place. And Baron, by you taking the time to give me a platform for my voice, basically it's not making you part of the solution, my friend. You are the solution. And that's the message that all the audience members need to have. You're not part of the solution. You be the solution, and the way that you do it is not just by sitting down, but by talking, and hopefully it will reach the influential ears that will bring this madness and bring this war on chronic pain to an end.
Right, because we are aware that the squeaky wheel is one that's always heard, and if it takes us, doctor, being the squeaky wheel and putting out honest information that people can utilize to try to help make their lives better, we are all for that, because again, our message is clear. The number one goal is to just simply make a difference. If we have one caller that's out there, one listener that's out there, Doc, on each individual night, as long as that individual caller or listener can take away something that we've said, that they can go back tomorrow or somewhere thereafter and make a life better, then we have done our job. So when we go to bed at night, our number one thing is we want to know if we were able to make an impact. And tonight, doctor, with all the engagement, with all the people listening in and sending us positive feedback based on what you have done, I think if you use baseball analogies, a home run. If we use a basketball analogy, we have scored the winning bucket. Football, we've scored a touchdown. So I don't want to hold you too long. We're looking at about 8:36 p.m. Central Standard Time, and like I said, I know people's scared. So before we close, I want you to mention all of your books that you have out there, and make sure that people can go out and look, search, and get all the information that they need, as well as any other piece of information that you may have jotted down that you have not had the opportunity to do so. You have as much time as you need, but I don't want to hold you too long, so I'm going to allow you the opportunity to get that much information out right now.
Okay, and I appreciate that. I would like to encourage all of your listeners to join me on Facebook and Twitter. You can search by my name, Harvey Jenkins, or by Facebook.com/OKCBodySculptor.com. Make me your Facebook friend, and we need to have a dialogue. I also have an author page, which I talk about all of the things related to chronic pain and the war on chronic pain, and what I can do and what everybody else can do to try to help switch the balance. And that's Facebook.com/Harvey Jenkins, MD, PhD. And again, if you message me on any of those pages, I'll direct you to the right page. You can find me on Twitter at Body Sculptor OKC, or just search Harvey Jenkins, and eventually you will find me. And then to find my books, you can go to Amazon.com, and I have 2 books listed under my name at this point: The Patient's Guide to Pain Management, What You Need to Know to Navigate Through the Stigma to Get the Care You Need. And again, Harvey Jenkins, you'll find that book there. That's the first book, and that's the book that every patient and everybody who cares for patients and everybody who has a loved one with chronic pain needs to read to simplify your life and to enhance the life of people in pain. The other book is 5 Ways to Effortlessly Outsmart Your Pain Doctor, What You Need to Know to Navigate Through the Battlefield of Pain Management to Get the Care You Need. That's also on Amazon as well. I want to get the word out about these books. They're not going to make me a rich man. They're so cheaply priced, and again, I'm not concerned about that. I'm concerned about getting the actual message out and having a dialogue with people about these issues. There is power in numbers, and numbers of people who get together and speak with one voice are more likely to get someone to listen and the appropriate response. And so I really do believe that we can make a change. I'm too old, fat, and ugly to run for office, so that's not going to happen. So in the meantime, I just need to basically keep exposing the truth and exposing the problem, and hopefully we will arrive at a solution that makes life better for all of us.
Dr. Jenkins, I believe Michelle indicated that you have a GoFund account set up as well.
Absolutely. Suing the state of Oklahoma is not an easy undertaking, and I've already committed to $45,000 of money that I really don't have to the cause. But I need money to help with that fight, and I set up a GoFundMe page. It's GoFundMe.com XDDR28. You can just probably look at my name under the GoFundMe account and read what's going on with the suit and the reason why I am suing. And again, I need the support of many in order to bring justice and bring change to Oklahoma. And one man can't do it, but one man that screams loudly, who has a lot of friends and an army of supporters, can.
Well, I'll tell you, Doctor, you indicated that you may not be the one to run for office. However, just based on you having the courage to talk, you may, in fact, inspire and encourage somebody else that's out there who's looking for a political platform to, give them that foundation to run. And I think that all of your supporters that are out there, like I said, they have the option. They can always reach out. And because our goal, like I said, is to always provide valid information that people can use. Okay, we have no pros and we have no cons. We're just simply out here because, see, if you on CNN, Fox News, MSNBC, CBS, ABC, and all those other affiliates, they would script you to talk. And if you get off the script, they're going to mute you, go to a station identification break. We have allowed you to talk 100% open and accurate to the audience that's out there. I have commercials that are input in here that I could have stopped every 15 minutes, but I chose not to. Why? Because I wanted to make sure that everybody that's out there supporting Dr. Jenkins, everybody out there who is going through chronic pain, you now have somebody that you can reach out to, whether it's on Facebook, whether it's through the Smoking Glass Hour, and we try, send that information to you. There's another avenue. And see, every day what people fail to understand is that internet streaming radio, podcast in the next 5 years, traditional radio will not even exist the way that it does today. So I want to make sure that everybody understands that people such as Dr. Jenkins, people such as yourself, just a man that's on the bottom of the totem pole, you have a voice now. Because, see, I don't get paid to do what I'm doing. All I do is get enjoyment out of knowing that we have provided an avenue for other people to be able to listen and not have to worry about the mainstream media stopping you from doing whatever it is that we're doing. Now, there's another listener that said, a really good show. I enjoyed every bit of it. Thanks, Baron Glass and the doctor. Thanks to you, listener that's out there. We want to make sure that everybody understands that you can reach out to Dr. Jenkins. We know by him being a physician and his practice being very busy. We know that if you reach out to him today, it may be a couple of days, but what he's saying is this. He'd much rather you reach out to him and try to catch him rather than assume that he's a doctor and he won't respond back to you, because his goal, based on what he said tonight, is to try to make a difference in the chronic pain area in your life, so you now have an option that you can reach out. There's another listener that's out there that's sending information. Smoking Glass, our number one. I'm not going to say we're number one, but I can tell you this. We're doing everything that we can do to make sure that you invest your trust and confidence in us. We're not trying to be Tavis Smiley, Tom Joyner, or anybody else. I have my own style, and my style is led by the ability that God gives me, and that's what we're going to continue to do. Dr. Jenkins, I want to say thank you for coming on. I want to say you had the ability to convey the message that everybody else that's out there needed to hear. And again, any time of the month, and we'll get back with you, administrative assistant will get back with you ASAP to try to work something out as often as you can, as often as you feel you have a voice that's here. If there's anything going on, any events or whatever that you want, that you're having, and you want to make sure that this get out to the general population, guess what? We will make sure that we do that to make sure that everybody out there can have that information. There's another caller out there, listener, that says, tell the doctor, thank you so much. Doctor, these are people, some of them that you've never met. They've been able to hear you tonight, and you have once again conveyed that message. I'll give you the final say-so, and then we'll conclude this segment of the broadcast.
Baron, I don't know how to properly thank you for giving me this opportunity. I can talk all day in my house to my little dogs and not make a difference, but you've given me a megaphone this evening, and again, I will never forget the opportunity that you've given me, and I will add that to my list of things that I need to keep in mind, because one day I'll have to pay you back for this.
Well, I'll tell you, Doc, not meaning to cut you off, there's no quid pro quo going on. Only thing I ask is that you continue to pray for us, and that we have the strength and the ability with no fear to address issues that are out there that most people are afraid to address. That's the only payback that I ask from you.
And if I can find a way to do that, then I will do that, and I will speak with your administrative assistant, because, yes, there's a part 2 and a part 3, and there's always going to be another part until we arrive at this solution. One of the other things that I forgot to mention that I'm almost embarrassed, there is a Facebook group called 338 Strong. This Facebook group was started by a number of patients of mine who are also concerned about the climate in America and in the state of Oklahoma with a drug policy, and they are determined and committed to do something about it. You can find them on Facebook at facebook.com/338strong, and learn all about this group and participate in the dialogue there. But this is an example of people getting together with a common mission, and so far they have been instrumental in changing some of the legislation in Oklahoma since they started in February of this year. And so there is power, and people just need to harness it and again come together as one, and we'll make those changes. And again, there are people like you out there who again give the megaphone so that we can make these issues known to a broader amount of people. And again, I am forever in your debt, sir.
Well, I can tell you, like I said, Doc, this makes me smile. Change is coming. That's from Michelle Carter out there in Oklahoma. I can tell you, Doc, we have been doing this for 2 years now. and we have interviewed people from movie stars, Ronnie Turcotte, who wrote, the Horse Secretariat. We've did Howard Gales from Larry Graham, guys from Too Short, Digital Underground. I mean, all over. And my goal is simple this. We want to make sure, like I said, that we can make a difference and an impact on somebody's life. And Dr. Jenkins, I tell you that we are very, very, very thankful for you. I really don't know how much more to say. I know that Sam Cooke has got a song that's out there. A change is going to come. That's my theme song. I always play that song. I chose to kind of, hold back on it tonight because I wanted to make sure that I gave you enough time. And again, we have 3 full hours to do whatever it is that, we want to do. But again, I know that your schedule is extremely busy. I know that there are people out there who have, they have been here from day one, Doc, just listening, sending messages, making sure that you were okay, giving all types of feedback to me. And like I said, I'm monitoring 3 different systems right now. And all of them are just giving me information on Dr. Jenkins, the type of person that you are, how committed you are, so forth and so on. And that makes me know that we made a big impact on reaching out to you. And the best thing that we could have done is what we did. We allowed you to come in and display this information. Like I said, if you use the baseball analogy, you hit not just a home run, Dr. Jenkins, but a grand slam home run. And here's one of the reasons why. If there's anybody out there who can't understand, this is why I am a loyal fan of Duke University. Because, see, once they put it in you, what's already in you, there's no other way that you can do it other than the way you were taught, and that's to go out and make a difference. So, Dr. Jenkins, I'm going to conclude and say thanks and good night to you. But before I do that, I'm going to close with Sam Cooke, sung by the Reverend Al Green. A change is going to come for the listeners that are out there.
Somebody say yeah. Say it again, say yeah. Somebody say yeah for the Rock and Roll Hall of Fame. You look good out there, baby. I was born by the river in a little tent. Oh, just like the river I've been running ever since. It's been a long time coming, but I know a change gonna come. Oh, yes it will. Look here. It's been too hard living, and I'm afraid to die. Look here. 'Cause I don't know what's up there beyond the sky. It's been a long, I wish I could come out there where you are, baby. A long time coming, but I know, look at here, a change gonna come. Oh, yes it will. Look at here. Let me say one more thing. I go to the movie and I go downtown. But all I can hear is somebody keep telling me, oh boy, don't hang around. It's been a long. If anybody know what I'm talking about, let me see you wave your hand. I know a change gonna come. Oh, yes it will. But I've got to take my time and say this, look. Then I go to my brother. Yes, sir. And I tell him, I said, brother, help me please. But he winds up knocking me. He knocks me back down on my say yeah, I could last long, no. I know I'm able. I'm able to carry on. It's been a long, good God Almighty, a long time coming, but I know a change gonna come. Yes, it will. Look at here. One more time. Look. Then I go to my brother. Somebody take your hand back and forth like this. Everybody. You sitting in the first balcony too. Heavenly, please. All over the auditorium tonight. All over the... Hallelujah. But he winds up knocking me back down on my knees. That's what I thought. I couldn't last for long. No, I know, baby. I'm able. Change gonna come. And oh, yes it will. Somebody say yeah. You all back here, let me hear you say yeah. Somebody say oh yeah. Say it again, say oh yeah. Somebody say yeah.
For the man, too much for the man, he couldn't make it. So he's leaving the life he's come to know. Ooh. He said he's going back to find, ooh, what's left of his world, the world he left behind not so long ago. He's leaving on that midnight train to Georgia. Leaving on the midnight train. Yeah. Said he's going back to a simpler place and time. Oh yes he is. Now be with him on that midnight train to Georgia. On that midnight train. I'd rather live in his world than live without him in mine. World is his and hers alone. He kept dreaming than live without him in mine. Oh, he's leaving on the midnight train to Georgia.
Leaving on the midnight train.
Yeah, ooh, y'all. Said he's going back to find a simpler place and time. Ooh, y'all. I've got to be with him. Oh, that midnight train, Georgia. Yeah. I'd rather live in his world than live without him in mine.
We are back broadcasting live with the Smoking Glass Hour with Baron Glass on WMAD 24-hour global radio. Tonight we had Dr. Harvey Jenkins on. We talked about the war on chronic pain. And I'll tell you, Dr. Jenkins, if you're still out there listening, and I know that some of your audience is still out there, if you could just witness all the text messages, all the Facebook messages, all the inbox messages that are coming in tonight talking about the information that you gave out here tonight. And I'll tell you, I am just smiling because this right here allows me to know that the simple things that we are doing, they are in fact making a difference. They are in fact making a difference, because otherwise you would not hear and witness all of this information that I am receiving. If you're out there, please go out and like the Smoking Glass Hour with Baron Glass on WMAD. You can catch us on TuneIn Live 24 hours a day, 7 days a week. We will re-air this particular broadcast. We will post it tomorrow. Usually we run every show at 3 o'clock p.m. Central Standard Time. So for those who are out there, they can also go out and listen to the archive. If they go on Spreaker.com, they can go and search for the Smoking Glass Hour and look at every archive show that's out there. They can also reach out to us on Facebook, Instagram, Twitter, LinkedIn, Tumblr, WordPress, and there's anybody else that's out there. And I want to say thank you to Mark Reese, Mr. Mark Reese, who actually contacted us last week on one of the pages that we have. And if you don't mind, if you go on the www.thesmokingglasshour fan page, the web page rather, and when you go hover on over to the right and look at the Make a Difference page, when you look at all of those Make a Difference photos that have been made by our very own very good photo op individual person, Miss Nina LaSalle out of South Louisiana, to be exact, specific, St. Martinville. Look at those photos and feel free to share. And each one of them will have an encryption of the Smoking Glass Hour and Make a Difference. And Dr. Jenkins and any of your friends that are out there, if you guys want to share those photos, please use those photos at your disposal. And guess what? We will also share this on the YouTube page, the YouTube video, when it becomes available. So if you go out there and you search for the Smoking Glass Hour, listen, what I'm trying to tell you, in 2015, we are on the move. And I'm listening to one of my good friends out in Baton Rouge, Louisiana, capital city, saying that he's been going through this for the last 5 years. He needs to get the doctor to get his information. Dr. Jenkins, like I said, I cannot stress how many people that is still out there right now, I mean right now, that is still sending me information. Like I said, I want to get you guys into some moves with some Gladys Knight and the Pips. We try to play some good music. We try to inform the audience. It's adult content. If you go out and check out, like I said, WMAD 24-hour global radio on TuneIn at 11 o'clock p.m., 11 o'clock a.m. rather, Central Standard Time, we have 1 full hour of Zydeco Music, which is some of the roots here in the state of Louisiana. Also at 12 o'clock, we have NPR News, NPR rather. And then from 5 to 6, 5 to 7, we have that nice music that gets you through the traffic jam. If you go from 9 o'clock, it's for the lovers. I forget what it is, after dark. But whatever the case may be, what I'm trying to tell you is this. We're not some type of fly-by-night piece of thing that is put together. If you notice a little text coming in the back, that's people still coming in on the Smoking Glass Hour telling us exactly what they heard here tonight. There's a Miss Esther that's out there. Want to thank her for listening and tuning in. I'm not sure what state. Mark Reese is out there. Michelle, of course, is out there. Lorraine Legg is out there. Wendell Thomas, Nina LaSalle, Miss Richardson, Miss Thomas. Again, I would fail to try to mention all of these names and all of these states. However, I will take a shot at it, and I did. So once again, we're going to conclude. I'm going to play a little Alabama, and then I'm going to come back with some Marvin Gaye, What's Going On, and that's going to conclude the broadcast. So here we go with some Alabama, Feel So Right. Here we go.
Whisper to me softly, breathe words upon my skin. No one's near and listening, so please don't say goodbye. Just hold me close and love me. Press your lips to mine. Feels so right. Feels so right. Lying here beside you, I hear the echoes of your sighs. Promise me you'll stay with me and keep me warm tonight. So hold me close and love me. Give my heart a smile. Feels so right. Feels so right. Your body feels so gentle, and my passion rises high. You're loving me so easy. Your wish is my command. Just hold me close and love me. Tell me it won't end. Feels so right. Feels so right. Feels so right. Oh, you feel so right, baby.
Hello, this is Pastor A.F. Riggins of Real Life Church, Houston, Texas. We welcome you to hear our broadcast every Tuesday night right here on Blog Talk USA and WMAD Radio, www.smokingglasshour.com. Real people, real life, real answers, a Bible study. Every morning on WMAD Radio and SpokenGlassHour.com, 7 a.m. Monday through Friday, you hear a word of God, a sermon. And on Sunday mornings at 9 a.m., same place, you can hear a word of God. If you're in the Houston area, come and visit us at the Real Life Church, 2703 Highway 6 South, Suite 150 in Houston, Texas. 10:45 a.m. is our worship. Also, you can tune in to Blog Talk USA on Sunday nights at 8 p.m. for Wrap It Up Live. Community issues with real people, real life, and real answers. This is Pastor A.F. Riggins. Looking forward to seeing you soon. Looking forward to hearing you on our broadcast. Remember, prayer still works. That's good news. That's the power in the name of Jesus to break every chain. Amen.
We are back broadcasting live with the Smoking Glass Hour with Baron Glass on WMAD 24-hour global radio. You just heard from Pastor A.F. Riggins, senior pastor, founder, Real Life Church out of Houston, Texas. You can catch Pastor Riggins right here tomorrow night at 7 o'clock p.m. Central Standard Time. If you need or in need of hearing the Word of God, Pastor Riggins is the man with real people, real life, real answers. Tonight we have been talking to Dr. Harvey Jenkins, the war on chronic pains. Want to say thanks to all who tuned in and have a blessed night, and may the good Lord see you through to see another day. Have a good